Welcome to Lesson 6 on CNM Glass of Medical Terminology. I'm Christine Cartwright at Central New Mexico Community College. I hope you have your index cards and let's get started. The words today, a lot of them are around what you will hear and see on a unit that deals with cancer. We're going to start with one of, not with that marker. We're going to start with one of our ending words, iasis. This just means condition. Remember we had osis that meant any condition. This is also a form of ending meaning that condition. So like psoriasis. Sore means itch, you don't need to know that, but psoriasis means a condition of itching, and people with psoriasis have itching. So you'll hear iasis on the ends of that. Urolithiasis, urine, lith, stone, iasis, a condition of having stones in the urine. Ectasis. Ectasis means expansion. Where you might hear ectasis more is when we're talking about using that incentive spirometer and we're telling the patient it's to prevent atelectasis. Atol just means incomplete. That's not a word we're going to write down. But ectasis means expansion. So atelectasis in the lungs means incomplete expansion because after surgery they're laying down. Maybe they have narcotics. They're not breathing well. So we're having them do that turn, cough, deep breathe and use their incentive spirometer. All right. We're going to go on with a new word. Benign. Benign means mild or non-cancerous. Carcin. Carcin is our root for cancer. Neo. Neo means new. And in a minute I'm going to start combining some of these. I hope you're already starting to think, you know, I've heard this before. I've heard it with cancer, or I've just heard it in medicine. Here's two you can put on the same card if you want. Onco means tumor. And oma means tumor. But what does tumor mean? So now make a card for tumor, because tumor means a swelling. So it's a swelling of something. Squam means scaly. All right, we're going to come up here again. I forgot this. Path. Path means disease. So let me stop here for just a moment. What about pathology? Would you send that sample down to pathology? We want to send it down to the study of disease, right? The department that studies disease. So you'll hear pathology a lot. Path means disease. Pseudo. Pseudo means false. So a pseudocyst, remember how we can use that combining letter? If a cyst is a sac-containing fluid and we think we have a sac-containing fluid and we don't, it just seems to mimic it, but that's not what it is, you'll hear people talk about a pseudocyst, a false cyst. It's not really a cyst. Okay? We're going to have another couple that you can combine on one card, and that's trophy and plasia. Trophy and plasia refer to development. So I want you to think back to the last lesson when we looked at things that were above, and perhaps you've heard of tissue hypertrophy, above normal development. You see that in cancer, right? Cancer is cells running wild, and you will have hypertrophy or hyperplasia, above the normal amount of development. We're going to have another one here where you can combine some terms on a card, and that's dis and malign or malig. Depends on what you're using with it as to how you pronounce it. But what do they mean? Flip your card over. They mean bad. So I have dystrophic cells. I have dystrophy. I have bad development. You've heard of maybe muscular dystrophy, bad development of the muscles, right? Dysplasia, often women go in for their pap smears and it comes back with some dysplasia, some cells with bad development. Maybe that's the precursor for cancer, and they will come in for a colposcopy, right? You already know what scope means, and you're going to find colpo in a further lesson. These words you're going to tend to hear all together when you're discussing the development of cancer, or maybe not. Maybe it's benign. Maybe it is not cancerous. And that would be awesome. Today's lesson is short and sweet, but I want you to take some of these words, combine them with some previous words, like neoplasm, right? Carcinogenic tumor, you know. Have you heard of squamous cell cancer? They are scaly looking cells. It's one type of cancer. Malignant, so malignant. Malignant is the opposite of benign. So if benign is mild, no cancer, what's malignant? Malignant means there is cancer. That's it for today's lesson. Get out your cards and keep studying.